Governments, doctors, in fact all of us are now rolling up our sleeves for the biggest mass vaccination program in global history. Australia only joined the mass vaccine effort at the start of last week. And in the first phase, doses are just going to quarantine and border workers, plus frontline healthcare workers, aged care residents and staff. The rest of the population comes later, but the government has set ambitious goals in the short and long term, including this one for the end of last month.
On the 60,000 doses, we're likely to achieve that either by Sunday night or within 24 hours afterwards.
And that's a goal that hasn't yet been met. By the end of last week, the government says it had distributed a little over 60,000 doses across the states and territories based on their population. And the Federal Health Department is looking after vaccinations in aged and disability care. And on these numbers, only around half of all the doses that have been delivered have actually been administered. And Victoria and Queensland are the two states slowest to ramp up. On these numbers, Queensland has only administered 22% of the doses it's received. Victoria's got to 30%.
We have always planned to start off within our capability and to roll it out progressively, and we've actually met our targets.
But those numbers will grow and we'll deliver on all the commitments that we've made to the Commonwealth Government, and no doubt they'll be striving to keep their end of the bargain too.
The government has previously stated a goal of giving a vaccine to everyone who wants one by the end of October, but pulling that off would require rapidly ramping up the delivery to in the order of 200,000 doses a day. That's far higher than the couple of thousand we're seeing a day at the moment. That means getting a much greater supply of vaccine doses and soon, and also having the medical staff in the community to actually deliver them once they arrive.